My name is Cathrine. I'm a health social worker here at Kibera. There's an NGO called Carolina for Kibera, and basically my work deals around health issues among the people they are working with in Kibera. So I'm actually based on a project that advocate for health for young women, especially both teenage pregnancy and also for adolescent boys too. So I would like to maybe share my experience on how far or where I started, because one thing I realized, I didn't just wake up one day and find myself here. So it is interesting because I think there have been a lot of mentorship lacking in the forum of health issues. So for instance, my own experience, I didn't know that I was going to land in a health sector, and it was very interesting because when I was growing up, I didn't have somebody to guide me. And I remember one day that I was just watching a TV and I saw people discussing about health issues, especially psychologically related issues. That's when I became interested. And imagine that was through TV. So it is very interesting how we find ourselves in health, especially now in Kenya, where we don't have many women in health sector. And according to African perspective, I can talk about something that may be a barrier, and of which we are trying to realize as Kenya when you're coming up, because we are living in a society where it is all patriarchal, where men take lead on everything. They are the ones to make decisions. Actually, when you go to certain jobs, maybe field of doctors or field of engineers, you'll find there is a difference between number of male who have been hired and number of female who have been hired. So I can say in Kenya we also experience the same, because if you're speaking about making decision in a household level, a woman will wait for the husband or the male partner to come and guide them. So for instance, if a woman wants to go and receive maybe family planning, of which it is it's supposed to be a discussion between the man and the woman, but you'll find they'll have to wait for the partner to talk about or to make decision on which services or which family method they would prefer. So I think that is a barrier in terms of issues to do with living in a society that it is male dominant compared to other places, because that's where I think gender inequality comes in, and actually it translated to health, where you find many people, especially young women, older women, they are not proactive in matters of health issues. Yes. So another thing I can say about also health and what I've experienced in my work of duty, I've been serving a very dynamic community where we have issues to do with religion, and here in Kibera we have different community people believing in certain religion, and you'll find there's a particular religion. I don't want to name names because they'll feel offended or something. So they'll say that they won't participate in such in leadership roles in matters, especially any leadership, maybe social, economical, or health-wise. So because they think that they are the lesser people in the community and they need to get also the same, because that's what their parents or how they have been socialized, that the religion aspect doesn't allow them, especially women, to do such things, because for them they think they were born to just take care of the babies and take care of their household. So you can find such religions are also putting pressure to them that they are not supposed to grow to other opportunities, where in issues to do with leadership they are not actually getting those opportunities because they factor in the religious aspects, and actually to translate to where we find now women are not actively involved. But one thing I know, in Kenya we are trying to come up with ways how we can work or empower women in various aspects, and also health-wise. I'm happy. I'm seeing there's a lot of issues coming out where we are seeing women coming up and addressing health issues. A good example is our First Lady, Honorable Margaret Kenyatta, who is actually advocating for health for all people, because that's what I believe. Global health is all about having health services being access to both genders, both male and female, and for her to come out just to give that notion or to empower young women or older women to embark on this journey on health, because what you see, majority of women are the ones who actually go to hospital where they seek health services because they are affected in one way or another, and compared to male counterparts. So when we have a role model like now our first lady, it encouraged some of our young girls, because seeing a mentor who is able to champion on a course on issues to do with health, actually it's like a motivation factor that they are proud and they can be able to do whatever issues regarding to health that affects them, and take initiative, any small initiative, because I believe something small, when you start small and you create an impact to us, that's a small group of people, it becomes something that people appreciate at the end. Yes. Yes, so solutions. There are many solutions, many solutions. But now, from my experience working in this community in regards to health matters, I think I was actually involved in a program that addresses maternal and child health issues in Kibera. And when we were starting this program, I was giving I was supporting it in terms of giving advice or technical advice on how to go about it, because we were dealing with women and issues to do with maternal and child health. That is a women area, and we saw there was a need, or there was an importance of empowering women in Kibera, so that we train them, we actually recruit them, we train them, give them enough information, give them skills that they need, so that they pass the same information to the neighbors that they live near to, especially the women. So what happens is that we saw there was a lot of interest from these women. And in fact, one thing that keeps me smiling every day is that we have a 76-year-old mother who is passionate about giving health information to the women that they live nearby, but because they come in, we train them about basic health needs, for instance, issues to do with going to hospital when you're pregnant, and seeking medical attention when somebody is pregnant. So she's very passionate on our work, because being 76 years, I wish, actually she inspires me, because we thought she was not going to be able to make it because of her age, but actually she has proven us wrong, because she still have a group of women of 20 of them who actually they work with she works with them and give them health information in regards to their maternal and child health care, and it has been a very good inspiration to me, if I can say. So having such experiences, I can see there's a solution where, yes, I have this information, I have the skills, and I know how to address health matters among young women and also among older women, but there was also a gap where we were leaving the men out, because like I've told you, in Kenya also we are a society where male are dominant in decision making. So we saw there's the need of actually talking to male on especially what this or 76-old women is doing with their partners or with their sisters or with their mothers, so they're able to understand. Because at the end of the day, if the woman is healthy, the partner is happier. Yes, so that is nice.